Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn the differences between terazocin and we have phenoxybenzamine. In terazocin and phenoxybenzamine, terazocin alpha 1 is more selective. In terazocin, it has less side effects. Whereas phenoxybenzamine alpha 1 is selective more than alpha 2, but it is not more selective as that of terazocin. Then here in phenoxybenzamine, there is most common side effect will be postural hypotension. Postural hypotension leading to reflex tachycardia is seen in phenoxybenzamine. Then we have in terazocin, oral bioavailability is very high, almost 90%. And one more important thing is we can use once daily dosing can be done with terazocin. Now if you see other drugs, alpha blocker selectivities, phentolamine is actually alpha 1 is equal to alpha 2 blocker. Then we have rauolzine or yohimbine, or if you see talazolin. So all these are alpha 2 more than alpha 1. Okay, thank you for watching.
Thank you and thank you for watching.